Hello, my name is Prajyot Singh and I'm studying Master of Predictive Analytics, and this presentation is for my unit New Product Development. My product concept is an AI powered medical diagnostic kiosk designed to improve healthcare access in rural communities. Rural and remote communities often experience poorer access to healthcare than people in major cities. Especially in Australia, most of the major cities are on the coastlines, and around 7 million people live in rural and remote areas, and many face challenges such as long travel distances, delayed testing, and GP workforce shortages. This map here shows the GP shortages, and the yellow bit, which is probably more than 95% of the landmass of Australia, shows that there are GP shortages all over the country. So, in order to improve healthcare accessibility, an AI powered diagnostic kiosk is proposed. In this, the user completes the first set of screening through a digital display, and their vitals or blood tests are recorded using the sensors that are connected to the screen. And then it goes through an AI assessment using all the nationwide patient data and only referred to telemedicine if required. So let's talk about the uniqueness proposition of the product. First, we have to talk about traditional telehealth services, which rely on video calls with doctors and what the patient describes. In many rural areas, people still need to travel for imaging or blood testing work. So my kiosk improves that by bringing basic diagnostic testing with sensors and an AI supported assessment using nationwide data and as well as telemedicine into one system. So the total addressable market is 7 million Australians who live in rural and remote Australia. And in addition to that, our serviceable available market would be remote mining sites or semi rural establishments or communities that have the infrastructure ready for this. And our serviceable obtainable market would be since we are going through three clinics at first, our initial rollout would be 12 cluster areas that have access requirements and access issues in one of the states through clinic partnerships. So, the customer acquisition and scaling strategy for the product would begin with a pilot with three semi rural clinics. And then we do if that works out, we do a B2B rollout working with mining companies in remote mining towns. And then if that proves to be successful, we deal with the government through rural healthcare programs and NGOs working in this space. And if that's okay, then we would move to a nationwide distributed network that can help with all the data and improve the AI system of the product. Thank you for going through the presentation. My product aims to make healthcare more accessible for every Australian, no matter where they live.